Hi, everyone. My name is Begonia Sevilla. I'm your host today. Welcome to this new episode. Thank you so much for joining us in this new episode of CT Latino News Opinion Plus. I'm going to be your host today, as I told you before. And for those of you who are tuning in for the first time, CT Latino News Opinion Plus is a space for our opinion pieces. Every Friday, we have a new episode where we have a guest that talks with us about current events and questions the Latino community is curious to know. This week, we have Dr. Virginia Bieluch. I think I said it right, Bieluch?
Yeah, close.
Yeah, all right, thank you. Who is the chief of the... Okay, thank you. Who is the chief of Infectious Diseases Division at the Hospital of Central Connecticut and an associate professor of medicine at the University of Connecticut School of Medicine. We are very, very glad to have you on this Latino community, and other communities of color are, you know, that disproportionately affected by the virus, COVID-19. So thank you for taking your time. Thank you for sharing your time and your knowledge with us.
Well, it's such a pleasure to be here and have the opportunity to address the people of the Latino community. Yeah.
Thank you so much. Bueno, let's start with the first question. So we're going to do it super quick because we want to do a very interesting conversation and very quick conversation with very important matters on the table. First question, pharmaceuticals company, including, Moderna and Johnson & Johnson, vowed not to seek approvals of emergency use authorization in developing a COVID-19, not to seek approvals or emergency use authorizations. So to create the vaccine, but it seems like the vaccine is being developed at rapid pace. So let me ask you this, how close are we to a vaccine?
Well, very difficult to say for certain. I have never seen vaccine development proceed so quickly. Part of it is there's just such a need to develop a vaccine, but the technology for developing vaccines is also been developing very rapidly, even prior to the COVID pandemic. So a lot of technology was there, and they have adopted some of what we call platforms that were being investigated for other types of vaccines, and now they have adopted them to development of coronavirus vaccines. So lots of reasons why things are proceeding so quickly. A lot of money has been poured into this. I heard last night there are about 36 vaccine candidates already and many more in development. So a lot of work has gone into this. Fortunately, we are blessed with having the technology available. So hopefully we'll have one, end of this year, sometime next year. But it's still a little hard to predict exactly when we're going to have a vaccine.
Okay, so we're seeing the spikes of the virus affecting populations in different parts of the country. But in Connecticut, talking about Connecticut and New York, the infection rate is low. Why is that so?
Well, I think we're all blessed to live in Connecticut right now, and New York and neighboring states. Our governor made a lot of wise decisions to shut the state down early on, and the people of Connecticut and surrounding states have listened to what the governors of those states have said and have really tried to do their best to decrease spread of this virus. This really requires an entire community approach, and I'm really proud of what the state of Connecticut has done. And I encourage people, I know you're getting tired of staying home and wearing masks, but we're really at a crucial juncture right now to try to prevent increased spread of this virus. So I think it's our lawmakers, our governor, but it's also the whole community.
Another question, how can we curb the virus effect on the Latino community and Black community, because they are disproportionately, and we said before, affect these communities are being affected so hard.
Absolutely. In the state of Connecticut, Hispanics are about 16% of the state population, yet about 29% of the COVID cases have been part of the Hispanic community. Black people are about 10.8% of the state population, but about 20% of the COVID cases. So yes, the Hispanic and African American communities have been very hard hit by this virus. And there are a number of reasons for this. People of color often don't have access to health care that they can afford. Thus, they have other chronic illnesses. Many people work in jobs where they could not stay home in March and April, and they had to go. They were essential workers, and they were as important at that time as the healthcare workers were, in that they kept us fed, they kept us having food and other products delivered, and just really were essential workers, which put them at risk of becoming infected with this virus. And many live in multi-generational communities. So there are a lot of reasons why people, Latino people and African Americans were disproportionately affected by this virus. At this point in time, the important thing is to just keep doing what you were doing. Wear your masks, try to socially distance yourselves. It is very difficult when you come from a culture that really values living together with family and close contact with families. And we understand that this is very difficult, but it's really important right now that we all continue to do our part to decrease spread of COVID-19.
You're right. Very important. University of Connecticut, UConn was one of the first universities to cancel athletics for the 2021 school year. As the chief of infectious diseases for the Hospital of Central Connecticut, were you consulted on that decision? What did you see that led that decision?
I'm more of a clinician who takes care of people in the hospital and people with infections outside the hospital. But the Department of Public Health has a lot of really bright people that have been advising them on that decision. And, I think our rates are low in Connecticut, and the Department of Public Health and the governor wants to keep those rates low, and thus are making decisions that are, with some people, unpopular. But I think in the long run, the important thing is to decrease spread of this virus.
Mm-hmm. I think it's the last question. So the last question is, what does the misconception of the virus being a cold come from?
Pardon me, can you repeat?
Yeah, what does the misconception, maybe there's a misconception of the virus that is just a cold. So where does it come from? Why people could think that or can think that already?
Well, that's an understandable misconception. COVID-19 comes from a group of viruses called coronaviruses. And there are 4 coronaviruses that have been circulating for many, many years, and they cause a common cold. And so very similar viruses, but yet have a very different illness. This particular coronavirus that causes COVID-19 is a much more virulent virus in many people. Now, a large percent of people who are infected with this virus have no symptoms, but can spread it to others. Young people tend to have milder illness secondary to coronavirus that causes COVID-19. And they may present with something that's like a cold or a bad cold. But again, they can spread to others. The difference with this virus is that it causes a much more severe illness in many cases that can lead to long hospitalizations, death, and even long-term symptoms we're seeing in some of the survivors. So although many people do well, some people don't even know they have the virus, it can cause devastating consequences in other people. And that's why it's very important to try to minimize community spread of this virus.
We have a little bit more of time, so I have another question. So when I have a lot of questions, but let me pick up one. So you think that we should wait? Because a friend of mine told me yesterday, begonia, somebody said to me, and news are saying that we need to wait until 2021 to get a really nice vaccine. So this is maybe the timing which, you know, the doctors and scientists are, you know, saying, or what do you think about it? You think that we should wait until 2021 or maybe more than that to get over this?
Everyone wants a successful, safe vaccine. And it takes time to study the numbers of patients you need to study to get good information. A number of CEOs of pharmaceutical companies have signed a pledge saying that they will not release a vaccine until they're certain that it is safe and effective. Again, I don't have a crystal ball. You know, I'd love to see a vaccine as soon as possible, but it's got to be a safe and effective vaccine. If we don't meet the safety and efficacy criteria, that is, if it's not a good vaccine, it's going to turn off a lot of people from wanting the vaccination. And in order for the vaccine to be successful, we have to have a majority of the citizens in an area accept the vaccine. So we really need to be very careful in terms of vaccination. And I think the pharmaceutical companies will want that also.
We have another question. We have a little bit more time. Let me ask you something. You are a person, you know, very concerned about this, and you were saying before, please practice the social distancing, wear your mask, be cautious, be concerned, because, you know, we really need to take it seriously. But let me ask you, people usually take it seriously, or which is the worst mistake, you know, humans usually do in order to, in order to, I want to be protected, but I always forget to wash my hands. Or what do you usually, you know, what do you usually see in the day-to-day in your, you know, around you? What is the worst mistake we are making?
Getting together in crowds and not wearing your mask. Those are key. Yes, absolutely wash your hand, but the majority of spread of the virus is going to be from one person to another when a person who is infected with the virus talks, sneezes, or coughs and is close to another person who is vulnerable to getting the virus. So to the extent possible, please avoid large crowds, and please try to wear your mask when you're out. And don't go out if you're sick. If you're not feeling well, get yourself tested. You know, there's a lot of testing sites. Hartford Healthcare has testing sites. In the last 30 days, about a quarter of the people that have been tested at Hartford Healthcare testing sites have been Hispanic or Latino. We have information in Spanish for people where they can get tested. We have social media from Hartford Healthcare. We have our Spanish language website that will help you. If you're not feeling well, or if you've been exposed to somebody or you're otherwise concerned, please get yourself tested, because that gives you valuable information that you can use to try to protect others who are close to you, and to seek treatment if necessary, and to know what you have. Very powerful information.
Nice, good to know. It is very important to protect, you know, myself, yourself, but at the same time we're protecting others.
Absolutely.
That's very important, right?
And
okay, so if you want to, yes?
I think it's also really important in terms of a successful school year. We've got to keep virus rates down, and that's in the hands of all of us. Our children's education is really in the hands of all of us right now.
Yeah. We share that responsibility, all of us, right? So I don't know if you want to highlight something before, you know, we finish this conversation. I don't know if you want to point out any other thing besides the things that we said before, Doctor.
I think information is power. And again, at Hartford Healthcare, we have a lot of information in Spanish as well as in English. And the other thing that has come up is the mental health issues that have arisen in terms of, you know, this whole thing. People have lost loved ones, people are stressed, people have lost jobs, and don't hesitate to seek help if you feel that this is getting to cause depression or anxiety. Hartford Healthcare has a Hispanic center at Rushford with Spanish-speaking clinicians. So if you need help in that way, please do not hesitate to reach out and seek help. It's a very stressful time, and many people have a lot of stressors, in families, loss of jobs, you know, trouble making ends meet. So please don't hesitate to reach out.
Okay, so thank you so much for your time. Thank you for sharing your thoughts and your feelings about, you know, these crazy times, these very tough times we're living since the pandemic started. Thank you so much, Dr. Virginia Bieluch. Thank you so much for joining us. And we're gonna say that we were very happy for joining us today. Tune in next week for another episode. Follow us on Twitter, CT Latino News, and Instagram, CT_Latino News. I'm Begona Sevilla. It was my pleasure. And with CT Latino News Opinion Plus. So see you soon. Okay. Thank you so much. Have a great day. Have a wonderful day.
Thank you for asking me. It's a pleasure.
Thank you.